Hi everyone, my name is Shannon and I am a medicine resident. I have gotten a lot of questions asked about how to be more efficient, what is a good way to chart check. I'm going to share with you my tips and tricks and how I do it. The most important thing is coming up with a very systematic way of doing it and then sticking to that, because the more you do it, the faster you get, and also that will ensure that you don't miss anything. So let's start. Okay, I kind of drew out an outline and mined my chicken scratch. First, when I get a new patient, meaning I get a call from the emergency room, hey, there's a patient that you need to admit, or if I am starting a service and this patient is new to me who has already been in the hospital, these are some of the things that I do. So first, always check their name, age, and sex. And I like to know what their chief complaint was. What is their chief complaint when they came into the hospital or the ED? So usually you can get that on the ED notes or the H&P. And sometimes this might be different than why they're admitted. So this is, it could be different. So, they came in for shortness of breath, but they're actually here for cellulitis, anything like that. So it's always good to know why they presented themselves and why they were admitted. The next thing that I check is the problem list and their past medical history. So this is just an overall review of their past medical history. It's very important as a physician to recognize their baseline and the trends. They might have kidney problems or heart problems already, and so those numbers are going to be abnormal, but it might be their baseline. And then we also love to look at trends, what it was, 3 months from before till now, and what has changed. Doing this requires some detective work. First, you might have to look at outside records if it's not in the EMR. You might have to look at clinic visits. I love looking at these because they show the patient's true baseline. They're just coming in for a normal routine visit. And so usually their weights, their vitals, and all of that is their normal. And you can also tell, what changes were made outside the hospital and what people were being managed for. And lastly, you always want to look at, again, trends. So I like to go to the last hospitalization that they had. What was it for? Was it for the same problem? And what did we do that time that we can do differently this time? Or, are these just two separate problems? Yada, yada, yada. This is even before I look at anything that is pertinent to this visit. I look at all of this first. And obviously, medical history also includes like social history, surgical history, anything that's pertinent to the patient. Now we got to this admission. When you're looking at this admission, I always look at the ED notes and what they've done in the ED. We kind of go through this systematically. First, I look at vitals. And vitals includes heart rate, their temperature, the blood pressure, their breathing status, are they on oxygen or not, if they're on a ventilator, if they need any any type of support like CPAP, BiPAP. I also look at their ins and outs if they have any. That's important depending on why the patient is here. And also sometimes we end up giving patients so much fluid that we don't even realize it, and they're really volume up. If I can, I look at telemetry or an EKG. And in addition, if you look at an EKG, you have to look at a prior EKG as well. So we love trends. I'm going to repeat that because I've gotten in trouble so many times for looking at just the current lab or imaging, only to realize that they have had the same thing in the past. Next, you look at labs. So, this is kind of the fun one because you can see if there's abnormalities or not. But usually you look at trends. So let's say their hemoglobin is 9. The 9 itself does not mean anything, okay? Unless yesterday their hemoglobin was 14. Now it means something because they significantly dropped. Or if it was a 9 prior, then that just means that that's kind of their baseline. So you always have to look at trend. If you look at the number, you always have to click back and look at what it was yesterday and even what it was a few months ago. You know, we're looking at the basic labs, CBC, CMP, electrolytes, but sometimes these are the ones that catch you off guard because you've been waiting for them for a long time, or they haven't gotten. So like they're either panels, cultures, pathology, if you got like a biopsy of some sort. So the tip here is follow up on if it's drawn or collected, meaning sometimes the order is in, but nursing staff or whoever's supposed to get this hasn't even done it yet. You're kind of stuck. Also follow up if it's getting processed, because you want to know that information right when it results. The next thing I look at is imaging. This could be x-rays, CT scans, ultrasounds, echoes, all of that. Those are all in here. And again, it's so important to compare. So you're looking at an echo, you need to compare it from the last echo. If you're looking at imaging, you need to look at the last imaging. These trends are very important. So I want to stress right here at imaging that you need to look at it yourself, okay? You are a doctor, you were trained in reading images. When you read the images yourself, honestly, then it becomes a discussion between you and the radiologist. If your thought process is correct, that will add to your knowledge, or it will also help them correct their read or adjust it accordingly. This is kind of what takes up a lot of time because you're no longer just looking at the single number for today, you're also comparing it to prior visits. The next thing that I look at is meds. So what they ordered and what they actually got, because sometimes it's ordered but patient refused or wasn't given, something like that. So I need to know. This one is number 5, but it kind of goes up here depending on where you want to do this. Usually if this is a patient that I know, I usually go to this first, but sometimes it's better to review everything else before going to the notes. I review nursing notes. I see if there's any overnight events that's documented, like a significant event if they had a rapid or something like that. I look at any new notes. Sometimes when I leave the day prior, some notes are not in yet. They should all be completed by the next day. So I check these. I check it from everybody in the chart. So there's case management notes, there's physical therapy, occupational therapy, there's wound care, all of these things. You need to read everything. Lastly, you read your own note because you might have just picked up this patient yesterday. You still familiarizing yourself with this patient, so check that because your note should have everything in it and what the plan was for yesterday. So that's basically chart checking. And then after chart checking, these are the things that you need to decide to do next. 1, if they're very sick just based on your chart check, then go see them ASAP, okay? And let somebody know if you know they are not doing well. Don't wait until rounds to formally tell the attending about them. If this is not the case, then you can come up with just a simple plan, just 1 or 2 bullet points that you think of stuff you can do. Doesn't have to be too robust, especially if you're starting out as an intern. Next, think about dispo. So the patient is in the hospital for how many days now? How are they getting out? What is the safe discharge plan for them? And do they still need to be in the hospital? So I always think about this as well. And then these things, you can order extra stuff. Like let's say they have really low potassium, like super low, and then you have to replace it. You would put like a repeat at whatever time you think is appropriate. So this is when you add some extra labs and images and stuff like that. Lastly, you start a note. So I put a note in there just so that I know that is my patient, and then I have a note to complete. Okay, so that's it. Lastly, I want to show you my basically checklist that gets me through the day. Make sure that regardless if I had 3 or 10 patients, I complete everything for them. I use a circle. Most people use a square. To me, a circle is more efficient. You just do that. First, if I've seen them, I put 1 swiggle through it. Like I don't fill it out completely. That means I've seen them. You'd be surprised how many patients you forget to see if you don't mark them. So orders and consults. Next to the patient, I usually have a checklist of what I need to do with that person. So these are already next to the patient, and after I do them, I would check them off. And basically this circle, I would do 1 line like this if I've completed all the orders for that patient or the consults. notes is usually a dash to this side, to the left. That's how I know. So sometimes maybe I'll have like, I'll start at a note or I finished the note on them, but I still have orders to do. So I will keep that not marked. At the end of the day, after I've checked everything, I go ahead and circle it in, and that tells me I am done with that patient. Do not need to look at them again. I hope that was helpful. Let me know if you guys have any more questions about becoming an intern, and if you want any more advice, let me know in the comments and I'd be happy to answer. Bye.